All right, so we're going for the next performance OSCE, which is your extraction, exo, okay? Like any other performance OSCE, you need to know the correct chair positioning. You need to know the correct instruments. Now with extraction forceps, we need to know the correct instruments. Absolutely. If you remove an upper tooth with a lower forceps, you can't pass the exam. At the same time, we need to know which forceps is which. We need to know the correct chair positioning. We need to know the correct grip. We also need to know the correct movements when pulling the tooth out. At the same time, we need to know the supporting movements with the side hand as well, because we need to understand with an upper teeth, we generally support the bone. Lower teeth, sometimes we support the jaw as well, and it's important. This is the OSCE that generally you will not be using your mirror. Local anesthesia, it's important that it's a very sharp thing. You can prick yourself. Extraction, we generally want to support the bone, the jaw, around areas. So we really need to have a support on the hard tissue to have a firm grip to what we're doing. Now, if you have a look, generally, and with the ergonomics and everything, a lower teeth generally have a right angle turn to it. And that's why they're considered for the lowers. The upper ones are generally straight. You just go in. The lower ones have a 90-degree generally bend to it. So at a right angle, so generally they're for the lower ones. That's the difference. Breast, you will notice that this is for the central incisors. The molars, the tricky ones, which everybody gets confused. We need to know where the pointy beak is coming. Because as we all are aware, the upper teeth have kind of like 3 roots. So the palatal goes here and the buccal always have that beak. That means it's going on the buccal side between the 2 roots. Now, if I hold it like this, and if I know the beak is on the right side, that means on the buccal, that means this is for the second quadrant. If I notice this one, this is for the first quadrant. So right selection of instrument is important. At the same time, you need initial instrument to break the PDL, which is, you can use a straight elevator or a periotome or a periosteal, something to show it to them that you're disengaging the PDL. Then you can engage the forceps and we do work on the movements. So if I show you for an upper tooth, and if I, again, opening the instrument, you drop it just like that, and I will open one lower instrument just to show you how the feel of it. Okay. All right. Now again, if you want to do it sitting down, you can. If you want to do it standing, it's completely up to you. Just make sure elbow is where your working area or the head is. And at the same time, if you are doing an upper tooth, then ideally it has to be supine, the patient. If you're doing a lower tooth, then ideally 45 degrees. So their occlusal plane is parallel to the floor is ideally what we do. So again, normal protocol that you follow, wash your hands, make sure, don't forget this, wash your hands, mask, then glasses, then go your gloves. Now, when we are doing the gloves, we have already done everything and we have everything going to everything ready. We have the instruments ready, everything is good. Now's the time that we do it. They can ask you for an upper extraction, they can ask you for a lower extraction. Now, for example, if I'm standing, look at my elbow here. If I'm talking about an upper tooth, that means it has to be more supine. Okay. And you will notice your whole body moving. You will notice your whole body moving, okay? Now, this is more likely close to my elbow, okay? Front tooth, okay? Now, the thing that we need to understand is we need to support, right? So one finger goes on labial or buccal, one goes on palatal, just like this. This is very important. Now, there are few concepts. A lot of people say that your 3 fingers are covering patient's eyes. So you can either do something like this to do it, or you can release it like this. At the end of the day, the patients are always wearing some eyewear or protective eye, or they have the eyes closed, so don't need to worry about the 3 fingers. But what is more important is you have a grip. Okay, now just imagine if I do it too low. What happens now? As soon as I grip it, I have to bend it to see what I'm doing. That's wrong. So make sure it's high. At the same time, if someone says, I want to do it sitting down, okay? So where is my elbow? My elbow is down, the patient is high. I've seen patients, like people making videos, and they're pulling the tooth out and their shoulder is that high. What are you doing? That's completely wrong as well, right? So what you need to see accordingly, and your body is gonna guide you. It's gonna tell you how it's gonna do. For example, let's talk about a lower tooth. And let's bring it to 45, right? If I say that I'm supporting the jaw here, okay? 1 finger buckle, 1 lingual, okay? And if I am here holding this, then what I need to see is how my chair positioning is. Look at my posture. How am I standing? Straight. There. Everything is working, right? I'm not bending. I don't have to do anything because I can see what I'm doing. Same time, if I, for example, on this position, I try to remove an upper tooth, what happens? I cannot see it. So then what it means is I have to come back like this. That's where it's wrong. Okay, so again, if I have to do an upper, correct the chair position supine. If it's a lower, do it a bit more on the 45. Now, there's certain teeth require different movements. If you talk about the central incisors, single root, you need to do apical pressure, okay, which is the first movement. This is also called as the engaging motion. Apical, you engage it, you also try to, and again, you don't need to know the science too much. They're not asking you to explain anything. So just do some movements like this, so they're aware that you did some apical pressure. And then central incisors, you just do apical pressure rotation. We don't do any buccal or lingual or labial or palatal. At the same time, the lower tooth, which is the lower second premolars, which is 3-5 and 4-5, you need to do apical rotation. Most of the other teeth, what we do is apical. We did do some buccal, lingual, buccal, lingual, buccal, lingual, release it, buccal. There's one teeth which is the lower second molars, and in which what we generally do is we do reverse. So we do palatal first, followed by buccal, lingual, buccal, and remove it on the lingual side. So this is the only difference, but mostly this is the protocol we need to follow. So they have asked us to do a central incisor, and what I'm going to do is I'm going to bring this a bit more supine. Okay. Bring the chair up to your height. Okay. And then what we need to do first, we need to use a periotome or a straight elevator to disengage. After that, once you've done it, make sure you're coming here, okay? And then a finger supporting on the labial, one on the palatal, engage it on the central. Again, don't do this. We're not hurting the patient, but at least we need to show some like this so the examiner see he did the apical, okay? Did that, and then gentle rotation, 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 and gently take it out. This is screwed in, so it won't come out, but just to give you a normal idea. Again, if I go back to the lower one, let's go back and bring this down, 45. Now on a general rule, and it's while I'm on the top, I'll tell you some chair positioning so everybody's aware of it. If I'm a right-handed operator, I need to stand, I can stand somewhere between 1 o'clock all the way to 7 o'clock. Okay, but generally extractions, you will notice you're good at 10. If I'm 10 or 9, if I'm doing lower molar, okay. If I'm doing a lower central, I can still stay at around 9 o'clock, 10 o'clock to do it, or maybe 9 o'clock, a bit better, okay. If I'm doing the central, then I can, on upper one I'm talking about, then it's good that I'm a bit more here, front of the patient, a bit on the 7 o'clock side, which I can see a bit better here, okay, and engage it, okay. If I'm removing this tooth, which is the canine, then what I would do is I will still stand at around 7 o'clock. The only difference will be I will request the patient to turn the head on the left side. So they can turn the head slightly like this. Thank you. Okay. So then what it allows me to do is I can see it better. Same with the premolar. If I'm removing this teeth, the more it goes, the more they can turn a bit. So then I can see it better and I can go from there. And then at the same time, certain times, if you feel, you can assess it better and then use the right forceps and do that motion that you can see. Central, again, ask them to look straight. They don't need to bend anything, okay? So then this is the motion. If I'm going to the second quadrant, then what you need to do is ask the patient to look on the other side, away from you. And then what you do is you get the motion standing around, say about 9 o'clock or around, say about 8 o'clock, or depends on which tooth you're doing, but generally around 9 o'clock and around 8 o'clock, you can see a bit better. And then you do the movements and take it out, okay? Lower tooth, again, as you're coming back to it, I thought I'll just give a basic idea of chair positioning to everyone. We are doing, say, about a premolar, lower premolar. Make sure I'm at around 9, I'm around 10 o'clock, 10, 11, where I feel comfortable. I feel 10 o'clock, I'm good. Here, where you can easily see that my shoulder is not lifting too much, my arms are not too away. It's at a relaxed position, you know, I can support the jaw, you know, it's at the elbow position. If you feel like the lower jaw is too far away, maybe lift it up a bit, okay? And then what you need to do is support. One finger is basically, I think this moved a bit, so I can just turn it like that. And then what we need to do is, yes, now it's better. So support the jaw, one finger here, one here, and then your forceps is here. You do the engaging, and then now, because we need to show it to the examiner with the help of a thumb, you do twice. Again, not like you're not banging somewhere, but then just do twice so the examiner will notice he did the apical engaging. And then what you do is rotation, 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 and in one came out. Generally, if you have a gauze, put the gauze in and ask the patient to bite. Now in this scenario, you can't ask the patient to bite. So to show it to the examiner, put the gauze, just close the mannequin's head like this. So the patient, now the examiner knows that you have basically followed it, the gauze and pressure. Same time, if you have to remove a molar, then same motion goes here, and then you basically doing buccal, lingual, buccal, lingual, removed it, buccal. If I'm doing the central incisor, then generally 9 o'clock works better. Again, it might be difficult to hold it like this. So then your two fingers come in roll, two fingers, one labial, one lingual, and then the thumb is supporting the jaw. Lower, you have to support the jaw, okay? And then go here, generally do the movements. And that is your basic exo performance OSCE.
I am making this video to convey my sincerest gratitude to Dr. Mac. Thank you so much, Dr. Mac, for providing with this comprehensive online technical course. because of which I was able to pass my part 2 exams. And I took his 6-month online comprehensive course, and it was amazing. Now, for me personally, even more because I started off my technical prep after 2 years gap from dentistry. I was doing my master's in the meantime, so I had no clue what tasks are asked, how everything is done in the exams. But once I took Dr. Mack's course, he has provided all the detailed videos with the demonstrations of all the technical tasks from, for example, in crown prep, from how to make a putty to how to polish your temporary crown. Everything step by step, in detail is provided in the course. So what happened for me was, in the 6 months that I took this course, I was in my home, with my home setup, in the luxury of my own time. I was able to look at the videos repetitively and, get a hang of all the tasks. And once I got a hang of all the tasks after 5 to 6 months, it's then that I took a on-site comprehensive 2 weeks course. So what happened was, I already went to a on-site course with a very core fundamental base of the technical tasks. And I cannot thank Dr. Mack enough for, providing all the detailed feedbacks and assessments that he does regularly on his WhatsApp group usually. So what happens is, once we get into his online course, we also become a part of a close-knit WhatsApp group wherein we can send our work, and Dr. Mack usually replies within, few hours with a detailed video feedback of the task that we have, asked to assess him. And that way it's easier for us also, again, luxury of our own time, from our own home setup. We can learn, we can get the feedback, and it's one of the best courses, honestly. So once again, Dr. Mack, thank you so much, and God bless you. Thank you.